minutes after 9 o'clock. It's a nice-looking Monday, but I think it's still kind of cool out there. Bern Paraiso was in the studio, and she'll be able to tell us because she just came in. And, of course, we're going to talk about health providers right here in Marion County. And Bern is our medical reporter with Good for All Marketing. Good morning, Bern.
Good morning. How's everyone today?
Is it cold outside? We're good. How are you?
It is not cold. It is just right.
You got a pearl necklace today.
I do.
And a monogram jacket and your blue ribbon on there.
It's the colon cancer pin.
Mm-hmm. You gave me one.
Thank you.
It's beautiful.
We are in our last week, being a March as a colorectal cancer month.
Oh.
So I'm wearing my blue, and I probably would put this aside until next year. Mm-hmm. So for the whole month, and we also have doctors' offices that are participating on it,
right.
Promoting and for the colon screening and educating the community about, getting screened.
Right.
Good morning to Dr. Brian Cragen at Open Arms Medical Center. He was our provider that called in. Remember him last year?
Uh-huh.
Oh, yes.
And he was, speaking a little bit about, I believe, allergy, and this is about the same year. I chatted a little bit with the staff and the wife, and the last 2 weeks. I mean, it has been famous for allergy
because of the flowers starting to bloom and everything.
The pollen.
Yeah.
Correct. Right. Anyway, good morning.
Did you ever hear that if you ate honey that was made locally, you would defend yourself against allergies better? Have you ever heard that?
I've heard about that, and like I said,
you don't know?
Is it a fact? I do not know.
Yeah.
But I love honey. I put it on my hot tea. Do you?
Oh,
Robin?
me too. Me too.
Right.
I love it. You
and
too.
Especially if you have cough.
I do.
You do.
I do. Yeah.
And
not in coffee. No.
Because we have a farmers market around here that they really produce
Yeah.
honey.
Yeah.
Now I'm wondering, is it mixed or is it really pure?
It's really pure because my mother goes there and she buys the honey from the Ocala Farmers Market on Saturdays.
I should probably
And
find
it's
out
very
and
pure, and
see
she loves it.
what's the benefit of that, and I'll bring in the result next.
Yeah, that would be
next week.
interesting
That's
from a
good.
doctor's perspective.
So again, watch out for allergic rhinitis or allergic dermatitis. This was a report from last week, and it could be common among doctors' offices.
Rhinitis?
Allergic rhinitis, allergic dermatitis.
Okay.
Oh.
That means skin. Does rhine mean nose?
Exactly.
Okay.
And this is the same time of the year. I don't know. It really depends, what the cold weather is and when, depending on the time of the year. But normally it's in February, March, I don't know, April.
And it feels cool today, right?
It is, and I actually love it.
You like it like this?
Yeah, when I stepped out my door, of course, I was a few minutes late. I wanted to go back and get either a scarf.
Another layer.
But I didn't have any time. So anyway, well, thank you everyone, and good morning to all our medical providers in Marion County and to all our listeners. I mentioned last week about the colon cancer deaths, because this is the colon cancer month.
Right.
That it can be prevented by early and regular screenings. Screening tests locate polyps, which are tiny growths that can become cancerous. The goal in screening is to find colon cancer in its earliest stages and to remove polyps before they become cancerous.
Yeah.
So colon cancer often appears without symptoms. So screening is essential in catching and stopping the disease early. And our current guidelines recommend first getting screened at age 50 or earlier if you have a family history of the disease.
Right.
So when caught early, colon cancer is both treatable and beatable.
We had a lady on the other day who had colorectal cancer.
Okay.
And she was stage 4.
Yes.
And she's over it now. Like a month ago, she was told she's done with it.
Congratulations.
And she was very active and healthy and living the right
athlete.
lifestyle. Yeah. Mm-hmm. So not somebody you would think would get this, but she did.
And imagine stage 4.
And we were using the information we learned from you.
Thank you.
So that we could ask more intelligent questions.
Yes.
Exactly. Well, I have
She
a report, and that is so smart. Thank you. Last week, and this is a real report from Central Florida Endoscopy Center. two patients. I didn't ask if it was a female or a male. In their 50s were diagnosed with stage 3. They did not have any family history
Wow.
whatsoever.
Oh, really?
So again, this disease, without symptoms, with or without symptoms. So ask your doctor about screening test, for colon cancer. Thank you
It's a
so
scary
much.
thing.
It is scary, but when it is caught on time,
So go,
just like what you have shared.
so the big
stage
lesson:
4.
go in early. Because I said that to her. I said if 4 years, because it was diagnosed 4 years earlier, right?
Yes.
So I said if 4 years ago or 5 years ago, you had gone in and had that thing with the camera goes up your butt, you could have avoided all this trouble. And
It's
and the doctor who was on the phone with her said, "Yeah."
She was just one of the many lucky people.
Yeah.
But nowadays, if we talk about 10 years ago or 15 years ago or 20 years ago, yeah, just like the male athlete. And he actually was a teacher. I'm trying to remember the name, Dan, last week, that died of colon cancer. And he was an instructor of it was some form of a sports also that he was very active, but he had a back pain. That was the complaint.
Same as she. That's what she said. She had a back pain. Yeah.
Back pain. No, the same thing with the chest pain. Well, when you have a chest pain, you don't want to take a chance on that.
No.
Go to the hospital.
Right,
However,
right.
if it is negative, talk to your doctor about getting a colon screening. Because guess what? Sometimes we don't really feel that it's lower. It's right here. It's close.
Right.
And there was
Isn't
a
it amazing
study
how
on it.
close our organs are? Like, you don't realize it. They feel like they're way far away, but they're right here. I mean, it's right there.
And I thought of you yesterday because in church during our coffee hour, my mom and I was sitting at a table next to a nurse, and the student came up to this nurse, and he said, hypothetically, he must have been 17. He said,
Okay.
hypothetically speaking, I had this friend, and all of a sudden he was starting to bleed down there. He said, should he just try to deal with it, or what should he do? And she said, you have to go to a doctor right away. You don't know, and it
Immediately.
could be your colon. And she said
Exactly.
that
And
to
let
him.
the doctor, make that decision. It could be rectal bleeding, but we don't want to mess up with that. And he was 17 years old.
Yeah, the fellow said, hypothetically, my friend, and she knew he was talking about him.
Exactly.
Wow, wow.
And
Yeah,
speaking of
scary.
Why
that,
do people say it? Why don't they just say it the way it is? Why do they say it that way?
Yeah, well, they're embarrassed.
By the way, when I'm
maybe
thinking
to
about
go
Bern in
see-
church, Jesus slaps my hand.
yeah, but speaking
Stop
of
thinking
That's
of,
right.
right, so
About Bern.
I'll make use of the remaining minutes discussing about the warning signs to look for. And you just mentioned that stool, blood in or on the stool, a change in bowel habits or stools that are narrower than usual, general stomach discomfort.
She looked
or
at me and smiled. I
frequent
don't know why.
gas pains.
General stool.
Bowels are narrower than normal. She looks at me and smiles.
Well, you're smiling at
she
me
know?
first. And here's another one: weight loss.
Yeah.
That occurs.
Didn't look at me that
despite no change. Weight loss.
Yeah.
Looking
Okay,
at
there
you
you go.
right
There you go. There you go.
No change.
Well, who would know about weight loss, though? Isn't that interesting?
Well, I think
fact?
this is well, of course, we don't weigh ourselves all the time, but you got to know when you're losing weight.
Yeah.
And then the last one is chronic fatigue. So these are warning signs to look for. And
Wow.
one, the blood in or on the stool that 17-year-old mentioned, is on the warning sign. Anyway, Seven Hill Gastroenterology, Vishnu Reddy MD, endorsed, the information and about the two patients that, they were diagnosed with colon cancer stage 3. That was endorsed by Doug Monteith. He's the supervisor of Central Florida Endoscopy Center. My time is up, and one more
One more
thing.
thing. One more thing.
Next Phenomenal Woman. You remember this?
Oh, yeah.
They are coming with me next Monday.
Are they? Okay,
And
good.
when you get your colon screening done, you're on top of your health.
How many phenomenal women are you bringing with you?
Phenomenal. Well, I only have a husband and wife, or maybe just the husband.
Well, leave him home. No, leave him home.
Dr. Akaji, right? And I hope it's okay. But this is like once a year they do the Phenomenal Woman, an evening of rest. Now, when you say rest, I don't think it only applies to women. You need your rest
Everybody.
as well.
Yeah.
Exactly.
Yeah. What time do we take the rest?
May 7 at Silver Spring Shores Community Center.
Oh, okay.
There's a big
Okay.
event out there, and they will be here next Monday with me. What time do we rest? I think as early as 8 o'clock. Get your sleep or take a nap. Can you
man.
take a nap? I'm not.
Oh,
bad
I
on
take a
that.
nap whenever I can.
Can you really?
He does. He takes naps.
Whenever I can.
You do a power nap?
I have to.
Or a cat? Really? I need to
Well, I
start
get up at
doing
3 a.m., so sometimes it happens, yeah.
I know that we need our sleep. Thank you again, everyone, for a beautiful Monday. And you all be safe. Oh, yes, this week is spring break.
Yes.
Yeah, right.
And thank you, teachers, and get your rest. And students, you do your best. And I also believe that the elementary students are doing their assessment test next week, so they'll be busy.
Oh, and they need their rest for that.
Exactly. You have to
Certainly do.
relax, and you want to
Man,
make sure.
I don't want to think about that right now.
Exactly. Yeah, right. We have to do our homework.
Yeah.
Yeah.
Thank you. It's awesome to be here, and I'll be back next Monday. Thank you for your emails, and I don't have any time to answer. Hopefully, I'll get there next week or the following week. Thank you all.
Very good. Thank you, Bern.
Bern. Bye-bye.
All right, we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunny to partly cloudy today, brisk and cooler.